I'm Dr. Katie, the Senior Centered Physical Therapist, and welcome back to my channel. In today's video, we're going to be addressing ways to decrease neck pain. So all you'll need is a stable surface to sit on. As always, please remember to give this video a thumbs up and hit that subscribe button, as it really helps people to find my channel and for me to continue to be able to produce content for the Senior Centered PT. Please check out my blog, theseniorcenteredpt.com, in order to gain more information about how to decrease neck pain, as well as a variety of other conditions that physical therapy can help treat. Let's start first by looking at all of the muscles that we're going to be working and stretching in this exercise routine. Let's look at all the muscles we're going to be stretching and working in this video. First, we're going to start with our trap stretch. So we're going to be stretching right up here, this upper trapezius. Next, we're going to move to our levator stretch. So levator is this muscle that's actually a little bit deeper to our trapezius, but it's hard to tell in this model, but our levator is what helps to elevate our scapula, levator scapulae. Also, we are going to be working some muscles in the front of the body here. So we are going to be working our longissimus coli and our longissimus capitis. So those are muscles that are deep in our neck, our deep neck flexors. Another big part of decreasing neck pain is making sure we have proper rotation in the spine. So for our thoracic rotation, we are going to be working muscles of our erector spinae along our thoracic spine. So longissimus thoracis, iliocostalis thoracis, semispinalis thoracis, as well as our internal and external obliques in the front all help us to rotate through that thoracic spine. We're also going to be doing some chest expansion, so we'll be working our rhomboid muscles as well as middle trap. That's all the muscles we'll be working in this video. Let's get started. First, we're going to start with chin tucks. So with chin tucks, we're going to take our hand and we're going to make an L. We can do it with either hand, doesn't really matter. You're going to take that L though, and you're going to place it on your sternal notch. So you'll find this little cutout that fits so nicely right there where your thumb can rest. Then I'm going to bring my chin so it touches my index finger. So for the chin tuck, we want to pull away from the finger. So we touch and pull away. I tell people it's like someone's trying to kiss you and you don't want them to. We all know that feeling, right? We pull away. We touch and pull away. So I'll turn to this side so you can see me a little bit better. We got the L, and then we're gonna touch and pull away. So the tendency is for people to do this, to lift the chin. We really wanna pull it back, because that way we're using these deep neck flexors in the front in order to really strengthen the front of the neck and allow for the back of the neck to relax, to be supported. So we pull back, hold for 3 seconds, and come back in. Pull away, and back in. Pull away, and back in. The good news with this exercise is these are endurance muscles, so we can't really ever do too many of them. So making sure that we're doing lots of reps throughout the day to really strengthen the front of our neck. Next, let's do our trap stretch. Now let's do our trapezius stretch. So what we're going to do is we're going to take our opposite hand, place it underneath our chair, making sure our shoulders are down. And then I'm going to bring my ear to my shoulder. Notice I didn't bring my shoulder to my ear. I really brought my ear down to my shoulder, which allows for us to stretch this muscle, that trapezius muscle, right back there. And we're just gonna hold that. And I want you to hold your stretches for a full minute. Now I know that seems like a really, really long time, and it kind of is, but what we wanna do is allow for the nervous system to relax. So you're gonna hold the stretch for a full minute, taking nice, long, deep breaths, allowing for the muscles to relax, and then eventually you'll gently bring that head back up. Making sure we're keeping that shoulder down. It's gonna have a tendency to ride up. Then we also wanna make sure we're actually sitting in our chair. So we're not leaning, we're not allowing one hip to lift. Keep both cheeks down on the seat. And then breathing into the side of that neck. Allow for length, allow for relaxation. If we need to, we can pull out a little bit of the stretch, give ourselves a little break. Or if this is a stretch for us right there, that's fine. We'll come up to center and we'll switch sides. So grab the chair, the opposite side, shoulder down away from the ear. And then we find that tilt of ear to shoulder, not shoulder to ear. Making sure too we keep our chin kind of up rather than down. Down's the next one. But this one we want that chin pointing forward. Here we go, we're gonna hold for 60 seconds. Each side's a little bit different, so I have to really make sure that this shoulder blade stays back and down. This stretch is a little more intense for me too, so I might have to be a little bit lighter on it to allow for my flexibility to grow. If we try to force a stretch, we're not going to gain flexibility because our nervous system's really going to tighten up on us. We want it to be nice and comfy stretch. That stretch feels good kind of moment. So if that means your head's here, it's there. That's okay. We're gonna lift that head up. Next, we're gonna do our levator scapulae stretch. So very similar to trap stretch, I'll grab the bottom of the chair. Then I'm gonna bring ear to shoulder. Then I'm gonna rotate my nose towards my armpit. And making sure that shoulder blade stays away. The shoulder blade stays down. And we feel that deeper stretch in that levator scapulae. Also, over time, we'll tend to rotate that nose away. We want to keep it down. So let's hold for 60 seconds. Checking in with your cheeks again. Are you fully sitting in your chair? You feel your feet on the floor. And then making sure we're breathing. Holding our breath and stretching is not allowing for relaxation, right? The nervous system panics when we're holding our breath. We're over halfway. Then when we come out of this stretch, we want to come out really gently. So we want to rotate towards that shoulder again, ear towards the shoulder, and then we lift our head up. So we're center. Kind of take a second, let yourself adjust, and then we'll find the other side. So it'll go ear, rotate towards that armpit, and then if you need to, the opposite hand can grab the bottom of the chair. For me, that's plenty of stretch without it. Just making sure my shoulders stay down, my nose stays towards that armpit. Breathing deep, we're over halfway. And then as we come out, we take our time. So making sure we rotate our ear towards that shoulder first. And then we lift up. Then allow for that head to kind of settle back in. Let that stretch just kind of release. Next, we're gonna be doing chest expansion. So arms are gonna come down by the side. I'll first show you sitting in the chair here, and then I'll show you a close-up of my back so you can see the motion that's actually happening. So we sit up tall in the chair. The tendency is to wanna lead with the arms. Look how much I'm expanding my chest. The reality is this is a shoulder blade movement. So shoulder blades are gonna come together in the back and then release, together and release. So from the front, that looks like this. Shoulder blades together and release. It's not a whole lot of motion in the front. You can see that my shoulders are kind of rotating back towards the back wall, but they're not flying back there. So it's shoulder blades together, release. Bring them together and release. We don't have to crunch them. It's nice fluid movement, allowing the shoulder blades to glide on the rib cage and let go. And then we think about collarbones widening as we bring the shoulder blades together. Now I'll show you a close-up of what that looks like from the back view. Lastly, we're going to be doing some thoracic rotation. So with neck pain, a lot of times it's that other places on our back aren't moving as well. So we have to get that motion somewhere. So the neck might be taking on more stress, more motion than it likes. So what we're going to do is we're going to rotate that spine to help free up the muscles of the neck. So we're going to take our hands, place them on our shoulders. Feet are going to be on the floor, making sure we're keeping contact with the whole surface of the foot on each side. And what we're going to do is we're going to rotate from the ribs, because that is where the thoracic spine is. So the ribs attach into that T-spine. So we rotate from the ribs. That looks like my hips staying forward. My legs aren't shifting. So I rotate from the ribs, and it doesn't have to be huge. I don't have to make it all the way back there, because that's not really my ribs anymore. So we want to rotate and hold. Take a deep breath. And then see if you can rotate a little more. And then exhale, come back to center. So what I want us to think about is pretending we're a spiral staircase. So as we rotate, we actually get taller rather than rotating down and getting shorter. So as I inhale, rotate, I get tall. I inhale again, get a little taller. And then exhale, back to center. Let's go one more each side. We inhale, get tall. Inhale, get taller, little more rotation. Exhale, center. Last one. Inhale, tall. Inhale, taller. Exhale, center. Excellent job, you have completed this workout. Thanks so much for watching this video. I hope it helps to decrease your neck pain. Remember to revisit this video to increase flexibility, increase strength, and overall have less pain and more function. As always, please give this video a thumbs up. Remember to subscribe to it as well as to my blog, theseniorcenteredpt.com. And as always, I'm Dr. Katie, the Senior Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.